it's just when we do local injection, we use nanoparticles to push it inside the cells and inside the nucleus of your fat cells. Once it's there, it sits there and it produces. Of course, your fat cells will divide over a certain period of time, and then that's normal multiplicational process. And the information can be lost in the process. That's why it lasts about a year. But there's no rejection. It's different from, you might have heard of rejection or issues or immune system issues linked to viral vectors. You can do gene therapies with viral vectors, and they could trigger immune response and get the virus, the vector itself, out of the system. It is true also for plasmids. Plasmids, it's a bacterial constructions that is similar to Minicircle that we do, but they kept some bacterial backbone in the process, while we completely eliminate any bacterial backbone in our Minicircle. So when you have bacterial backbone, it could trigger a response of the immune system that will take the construct out, the vector out.
How long is plasmid gene therapy? How long is it effective versus Minicircle?
Right. So because of that rejection linked to the bacterial backbone, they could have only a couple of months production, while we have a steady 12 months of production according to our measurements. Yeah.
And what about viral vector versus?
Okay, yeah, you're right. So viral vectors, if they are not rejected and they are big load of them so that some of them stay in your body, they could last for 20, 30 years. So it's a very different situation. Some of them, like the lentivirus, could integrate your DNA, so it's a real genetic modification. In the case of the adenovirus, it's not going to be that way, but still, yeah, it could be 20 to 30 years, which is, okay, so it's just one injection and you get it. But if you have a reaction to the virus, could be also 20 or 30 years of itching. I mean, we have seen clients who have had viral vector injection and they reacted to it, and so will still have that rash around the injection. Anytime her immune system is a little weak, they will have that reaction. The virus is still present in the body. The Minicircle gene therapies are safe and reliable, and they are working. So I like that, It's not like if you want to inject a viral vector, for example, in your system, you have to know you're injecting a virus. So you take a chance, because the virus will stay in your body for 20, 30 years. And that, to me, you need to have something serious to be ready to face the fact that you might have an immune response to that vector. I mean, that's my opinion. But I feel that the Minicircle are so safe and with no immune reaction, no integration in the DNA. So it's very safe to do it. Yeah. So in that way, anyone can have it. It's important to be even stronger in that. Very often clients believe that this gene that we're going to give them will integrate their own DNA. They cannot. There's no integration of the gene that we give into the DNA. That gene, that little circle of gene that we prepare, will be pushed inside the cells with nanoparticles, and they will go inside the nucleus. They will sit in the nucleus and use all the machinery of the nucleus to read the DNA. That's what nucleus is doing. But it's not going to go inside the DNA. There is absolutely no integration.